Hi, good morning. I'm Dr. Yeap. I'm a new Consultant Pediatrician with KPJ Sentosa, KL. So when we discuss about fever, when you look online, when you hear what other clinics, other doctors say, you get a wide range of temperatures. Some people tell you it's more than 37.5. Some people tell you 37.8. Some people tell you 38 degrees. But to make things simple, remember this magic number, 38 degrees. And how do we get this measurement of 38 degrees? It changes, depends on the way how we measure the temperature. So there are many ways. There's the thermometer under the mouth. There's a thermometer at the armpit. There is thermometer in the bottom. There is the one where we measure through the ear, and there's the one we measure through the head. So there are many different methods. The most accurate method for babies and for young infants who are below the age of 1 year old, the best one is with a digital thermometer placed under the armpit. This reading can be read after 1 minute, and this will be the closest and the easiest for parents to get the reading. For older children who can put the thermometer under their tongue, that will be the most accurate for you. So you use the digital thermometer, you can put a covering over the tip, place it under the tongue, and you can read the measurement after 1 minute. Of course, the ear thermometer and the forehead thermometer can be used as well. It's very fast, but remember that it's not as accurate as the digital thermometer. So to get the most accurate reading of the temperature, the best equipment, which is very affordable, is the digital thermometer, not the one with the mercury that you may have seen in old clinics. Digital thermometer. This can be purchased from any pharmacy at quite an affordable price, somewhere around 30 ringgit. It's easy to use. You don't have to change the ear cover like you would using an ear thermometer. So this digital thermometer can be used for even babies and for older children. I think that that's the best equipment that you can have at home. When your child has fever, naturally as parents you will feel very worried. Sometimes you may have brought your child to the clinic and they have told you it's just a fever, never mind, don't worry. But if the fever gets worse, you bring your child to the hospital, then the doctor asks you, why didn't you bring your child earlier to the hospital? It can get very confusing. So of course, the main question on most parents' mind is, when should you be worried when it is a fever? So the first question that we will be asking is, firstly, is it because of an infection? So when we hear the history from the parents that their child has fever, what goes through our mind is that we are wondering, is it because of an infection? Fever with symptoms such as cough, runny nose, vomiting, diarrhea. So these other symptoms help us to tell that it is related to an infection. But bear in mind, an important point is, if it is just fever with no other symptoms, it can be many other causes and it may not be infection. So this is something that you have to watch out for. If the fever comes along with cough, runny nose, sore throat, then most likely the germ is affecting the nose, the throat. If there is difficulty in breathing, then the germ has gone down to the lung. If there is tummy pain, there is vomiting, there is diarrhea, so it is likely that it's affecting the stomach and the intestine. So this helps us to differentiate the different types of germs which are infecting your child, and this helps us to determine what's the best treatment that would be helpful for your child. So it's a very important point to watch out for. But in the first day or two of having the fever, your child may only have fever as the only symptom. That's when it becomes difficult. It's very hard for any doctor to tell you which part of the body is infected and what would be the best treatment. So we need to have a vigilant watch and look after your child to see for more symptoms. How bad is it would depend on the child's condition. A healthy child would be active, would want to play with the world, explore the world. The child will eat, they will sleep. So these are the things that as parents we are able to see. So when the child becomes very unwell, they are not active, they are not eating, they are not drinking, they are not passing urine, and they are not sleeping well. So these are the signs that would worry you, that tells you that I need to bring my child to see the doctor immediately. And when we as the doctor examine your child, we can see the other signs. If it is a lung infection, whether there is difficulty in breathing, when we listen to the lung, whether the entry of the air is well or not, and other signs. So this would help us to know whether your child will be best treated at home or require hospital admission. So if your child is unwell and has fever, we are ready to help you, and you may come to KPJ Sentosa KL Specialist Hospital to see me, and I will help you help your child to get better. Thank you for your time, and have a good day, everyone.